Hi, my name is Irina Dralyuk. I'm a pediatric pulmonologist at Cedars-Sinai. I'm with Guerin Children's, and I've been working on a research project on a remote monitoring device for asthma in children. It's in conjunction with the Avice company, who's based out of Singapore, and I actually have the device that I can show you here. Here's a little box of it, and I'll tell you a little bit about my study, which we just completed and presented at ATS, which is the American Thoracic Society. So the device is just, if you can see, this little round thing that goes onto a little sticky and is able to be placed on a child's or an adult's chest. And it can be either left on for 30 or 60 seconds if we just want a one-time read, or overnight if we're trying to do overnight monitoring. So what we did for the study is we did a 12-week trial where participants were enrolled, and we just asked the parents to place the device on the children for every single night for the 12 weeks. And then what we're able to do is remotely monitor for vital signs, including heart rate and respiratory rate. And then also it picks up wheezing, which is a sound that the lungs make when there's decreased airflow through the small airways. This is very helpful because it's one of the symptoms we sometimes see with asthma, and it could be an early symptom, or if it's very loud, it could be happening later in an exacerbation. But basically what we're trying to do is, one, see if the device is able to pick up these sounds and let us know that the child is having asthma symptoms, but also see if it's predictive. So the research, the early numbers had shown that it was actually able to predict with fairly reasonable accuracy, about 66%, the likelihood of an impending wheeze based on vital sign variability. So basically that's the study. And now that we've completed it, I'm going to start using it in my clinical practice to help my patients prevent exacerbations. So a couple of things. One, being able to monitor patients in real time is something that we all struggle with in the pediatric world, because if I see a patient in clinic, let's say even every 2 to 3 months, there's still the in between. Having data and being able to interact with the patient or follow their symptoms in real time is something that a doctor normally is not able to do unless there's a device or some kind of a system in place at home. And it could be that the parent is keeping a journal. That's the most basic way. This is a little more advanced, right? This way we have data that picks up sounds and vital signs that allow us to actually intervene in real time instead of retroactively. When a family comes in 3 months for their follow-up, or if the child is already sick and we've missed that early window to intervene, if they're coming in later, now we're a little bit chasing our tail in a sense, right? Versus this way, we could do things going into the future, pick up early signs, which outside of this device, we don't have a way to do really, unless the parents are able to report clinically that they're hearing things or seeing increased work of effort, things like that. So basically the need is trying to intervene earlier and having some kind of information that we could base the intervention on. So that's kind of like the main reason that, I think this research is so interesting and that the device is so interesting, is that if we're able to have this device in the home of a family where they have a child or an adult potentially that has asthma, especially if this is a person that tends to have a lot of exacerbations, and we're able to monitor the vital signs and the wheezing overnight or during the day, then the family sees this on their portal. They're able to immediately intervene. So they have a plan that I provide them, or any physician could provide them, right? That if, let's say, they heard wheezing overnight, they take extra puffs of their medicine or do a nebulizer treatment for their baby, either during the night or in the morning. But it teaches the family basically on how to address the symptoms as they're happening, instead of allowing things to progress, get worse, and then we're having to give a lot more medication, and also potentially have more experiences in urgent care, emergency room visits, increased medication usage, like systemic steroids, which we're trying to avoid, if possible. So basically what it would allow pediatricians to do is catch everything much sooner, and then also educate their patient families on how to take care of their own symptoms right away, instead of it, getting a little bit more out of control. One, it gives us some data. right? It gives us numbers, so vital signs, respiratory rate. It gives us actual wheezing, which a parent, unless they're a trained physician or a nurse or some other medical professional, typically is not able to obtain in the home setting. So a wheeze is a very specific type of sound, and the device can pick up on that. So if I know that a child is wheezing overnight, and asthma symptoms tend to be worse overnight, so that's a good time to pick up on it, then basically that is the warning sign that potentially we have some issues coming up, or they're already happening and we don't know about them, right? So a family can only hear wheezing if it's audible to the ear, or again, if there's a trained professional in the family. That's not an expectation that's reasonable to have, that I can, have all my parents be pulmonary docs or nurses. And so parents are only going to see the things that are more obvious. And especially like early in the course of asthma, if parents are not very familiar yet, or if they don't have access to education from a pulmonologist or knowledgeable pediatrician, they might even sometimes, unfortunately, miss some of what we consider the later signs. So we've had kids come in significant respiratory distress. And it's not that it happened immediately. There's been a buildup to that, right? Which the device would allow us to pick up with these very basic numbers, because respiratory will go up, heart rate will go up, wheezing will increase in a lot of cases. And so it allows the parents to have some kind of a data point, some kind of a measurement at home that they can also track. And then it catches their attention. And then they start paying, looking at the child and seeing what else is happening. So basically, it gives us actual scientific measurements of what's happening in the child's body to help guide the parent and then the physician if need be. Yeah, it's been an interesting journey. Surprisingly, people are adapting to technology, I think, very well. It's a very easy device. It's light, The main thing is just keeping it on at night. So some kids, if they roll around a lot, will tell me, oh, it comes off sometimes. But there isn't any kind of painful or uncomfortable situation there. So it really hasn't been challenging. I have found my teenagers to be very interesting. I have some that love it. They're obsessed with it. They're worried that their internet at the hotel room on their vacation is not going to pick up the signal. Like they're really into it. And then I have other teenagers that are like, yeah, I forgot, for the last 3 weeks to put it on all but like one time. So it's like everything else, compliance based. Um, at least it's an intervention that's, I think, more fun and interesting. So I am finding that, and most parents with young kids actually really want the data. So they're usually generally excited. I've had some families where if a lot is going on, like if they have younger children, let's say like a baby in the house, I just had somebody hand in the device, and it's challenging to stay on top of everything, right? So if the child is healthy and doing well, they're less likely to use the device, which is fine. For the purposes of the study, it's nice if everybody does it all 12 weeks. For the purposes of real life, what I need them to do is put it on during periods that are particularly important for us. It could be viral season, it could be a weather change season. So it's not that they're going to be on it 365 days a year, but for the periods where the child is more likely to exacerbate, the parents that have kids with the needs seem to be driven because they're trying to prevent, poor outcomes for their kids. They seem to be pretty driven to put the device on, and it's very easy. I've had only one family misplace the device, so it's, out of lots of families that have enrolled in the study. So I feel like most people really stay on top of it. Not 100%, obviously, like anything else. I think it just depends on what's happening with the family, the kiddo. But overall, it's going really well, and I'm very hopeful that people will be able to use it without a whole lot of trouble, and it'll give them a lot of information, and then it'll give me a lot of information to help guide their treatment. I hope that it's going to become a normal, regular part of our treatment plan. My goal or my hope for this a device, for either this device or other devices that are similar, is for us to have access to technology in the home, because I think it'll just really make asthma management much better and much tidier. Right now, we're just hoping for parental report or patient report. We're hoping that patients will come in a timely manner. If people have ways to monitor their asthma at home, it's just like having an inhaler at home, right? You don't want somebody to have to come into the hospital every time they need a puff of albuterol or Symbicort. You want people to be independent. And so for me, these remote technologies are really truly the future of asthma, because it allows the patient to have a lot more autonomy and control, whether it's the parent for the child or a, older teenager. But it really puts the power into their hands of being able to see what's happening to their body, check in with themselves. They could put on a device and see, oh, I am wheezing, right? Like I did feel tight, but now, I'm aware, or if I did it overnight and I was sleeping, I didn't know, but now I see that I was wheezing, my respiratory rate was a little elevated, then okay, I need to do something a little bit different than what I've been doing in previous days. And then also the physician can see what's happening and they can intervene and they can adjust. Let's say over the course of the last couple of months, my patient has been wheezing 2 to 3 times per week, right? During nighttime, it tells me their maintenance regimen may not be optimized. So that allows me to improve my management of them in real time sooner than, oh, well, shoot, now they've had 2 emergency room visits in the last 3 months. We've had to have oral steroids multiple times. Okay, gosh, maybe I should optimize their management. So to me, this is really going to improve our ability to prevent um, emergency room visits, urgent care visits, hospitalizations, these big, horrible things that can happen with asthma, which unfortunately can even lead to death. ICU admissions, intravenous steroid administration, all these things that asthma carries with it in terms of burden. And then also basic things like days of school that kids are missing because of asthma, right? So if the parents are able to give them extra puffs, extra treatments right away, then there's not as much of a progression. And so they're not going to get as sick. The parents are not going to have to miss work. The kids are not going to miss school. These are all great things. And I think technology is a tool that we can all absolutely rely on going forward to help us with that.